statue of you still.
Probably.
Hi, I'm Hannah McDonald, and I'm here today to tell you a little bit about scoliosis. I am one of the 6 million people in the United States affected by scoliosis. In 2010, I was diagnosed with scoliosis, and in 2013, I had spinal fusion surgery to correct it. Onset of scoliosis is between the ages of 10 and 15 years, which is why it's so important that U.S. teachers are made aware of what it is so that you can look for it in your students. Scoliosis is a complex medical diagnosis that everyone needs to be aware of. Due to this, I would like to first explain what scoliosis is, then inform you on what causes it, and finally I will discuss the symptoms to look for. Though not life-threatening, scoliosis can cause strain on the muscles and organs due to the spinal curve. This is what a normal spine looks like. And scoliosis is a musculoskeletal disorder that causes an abnormal curve to the spine or backbone. Scoliosis causes a curve to form in either an S or a C. This is what the S looks like, and this is what a C would look like. Despite what many people might think, scoliosis is not a new thing. It derives from the Greek word scolosis, meaning crooked. It cannot be prevented, which is why early detection is so important so that it can slow down the progression of the curve. Scoliosis affects people of all ages, and both sexes are equally likely to develop scoliosis. Females are 8 times more likely to develop scoliosis that will need treatment. Though scoliosis usually occurs during puberty, scoliosis is not caused by physical activity or movement. There are 3 main causes of scoliosis, one being the most common. Idiopathic scoliosis is the most common type of scoliosis, but it has an unknown cause. According to Brown University 2008, 85% of patients are diagnosed with idiopathic. The second cause is caused by abnormalities present at birth. This occurs during the first 6 weeks of development, and during this time, the vertebrae do not properly form. The third is due to another neurological disorder the patient already has. Despite the 3 different causes, one might find it interesting that detection is not simple. Noticing the symptoms of scoliosis is a key part in diagnosing it. According to Shriners Hospitals for Children 2012, children and teens rarely exhibit symptoms, and sometimes the condition is not obvious until the curvature of the spine becomes severe. The year prior to my diagnosis, I began to feel a sharp pain in my left shoulder, and my mom noticed my right shoulder blade was sticking out farther than usual. Even though that these were signs of scoliosis, I did not realize it until after being diagnosed. There are many symptoms of scoliosis, 3 of which teachers should be aware of. The first is if a student complains of chronic back pain. The second is if the student's shoulders aren't level. And finally, if the student's shoulders blade sticks out farther than usual, like shown in this photo, then they most likely have scoliosis. If someone shows signs as I did, it is important that one sees a doctor immediately to confirm the diagnosis. After medical diagnosis, the doctor will go over treatment options with the patient and family. Once symptoms can be identified, the patient is one step further to living a better and healthier life. Though scoliosis affects those usually at a young age, it is important that everyone is aware of what to look for so that you can look for it in not only your students, but your friends and family members as well. So the next time you are walking down the street or hallway and you notice someone who may exhibit signs of scoliosis, please kindly tell them so that it can be properly diagnosed within a reasonable time frame. Thank you.
How is that person, are they sitting down and leaning over the edge of the bed?
That's me actually. I was sitting, this was before, the morning before surgery, so I bent down and like I just leaned over like this.
I just wondered how you
might
needed to be able to tell that, what position.
Who did you go to in McCall that figured it out, or?
I actually was diagnosed at an annual doctor's appointment I have for another disability I was born with, and he just randomly found it, you know, and so then I went to him for a while, and then I ended up going to McCall, and then Dr. Irvin, he referred me to Shriners, where I ended up having it done.
Are there other things you can do besides surgery? Do you know? Do they try physical therapy? Or
yeah, they recommend physical therapy just to strengthen like the muscles and stuff that surround it. It doesn't necessarily like do anything for it. One of the main things they try to do is brace. So they put like a plastic brace around you that usually you have to wear every single day for like a period of time. I couldn't be braced because my growth plates were closed, so I was done growing, and so they were like, oh, you have to have surgery. Yeah.
So surgery is the fastest and quickest?
Probably the fastest and quickest, besides the fact that I couldn't do anything for like the past 7 months, but yeah.
So the recovery is slower with surgery, of course.
Yeah, the recovery, but bracing, I think it depends on how bad your curve is. Depends on how long they have you wear it for. So, I think one girl, she used to go to school here, I think she wore it for like a year possibly.
So, if you're older, say an adult, they didn't realize they had it when they were a child, they were ashamed or, didn't want to go in and make a big deal or something, and they, as an adult, decide, okay, it's nothing to be ashamed of. Can they go in and have the surgery still, or the brace put on, or after a certain age do they prefer not to?
They can probably do surgery whenever. Bracing is only if you've done growing, you can't brace because it won't like change your body, and so yeah, surgery would probably be the next option.
So adult surgery is the only way that you